Hello, my name is Eric Christensen, CEO at the Heart of America Medical Center, and I have here today with me Dr. Hafaru, one of our physicians here in our clinic. Just wanted to bring you some information to the public here regarding COVID, with the rise of COVID within our county, and just give information out to the public. Wanted to let everyone know that as a small critical access hospital, our staff are working very hard, they're working very efficiently, but as small hospitals go, we're always staffed at a level that only can cover so many patients at a time, and so there is a limited availability of staff. And so with that, we're just in my conversations with hospital leaders around the state and with the current COVID situation, we are determining what's one of the best ways to keep your staff healthy and at work, and it is wearing a mask. And so it's just going out to the community and to my staff to say consistently wearing a mask keeps you healthy, prevents you from getting sick, and it also helps. Studies are finding that it helps if people that you're in contact are also wearing a mask. So I'm just asking as we go out to the community that people be diligent in wearing a mask, and then our staff be diligent in wearing a mask. We're wearing a mask while we're in the facility, and then wearing a mask when you're going around the community. This would help, like I said, keep our staff healthy, keep them at work so we can continue to take care of our patients.
Yeah, we've definitely seen an uptick of COVID positive symptoms, as most of you know already. Some of the symptoms that we are having in the clinic are like generalized fever and fatigue and body aches. Cough and shortness of breath are still really common. Loss of taste and smell seem to be very characteristic of COVID, and we hear that quite frequently now. And then recently there's been a lot more people complaining about nausea and diarrhea, some like GI distress type symptoms. The cough and the shortness of breath with low oxygen is the concerning symptom, and that's the reason that we would keep you in the hospital. There are some medications and different therapies for that, but if your oxygen is not low and you're not having trouble breathing, there's not a lot to do. You know, we have to remember that this is a virus, just like influenza or the common cold, and treat it based on the symptoms. So Tylenol, scheduled, you can do that 3 to 4 times a day. Push lots and lots of non-caffeinated fluids, especially if you have fevers. Then get lots of rest and take it easy on yourself. Lots of people don't feel well, and it's lasting a week, sometimes longer. So give yourself some patience and grace and just take care of yourself if you get it. And again, like Eric said, try to avoid getting it. Wear a mask, avoid unnecessary public gatherings, and just remember we are working really hard and we're stretched thin and doing the best we can over in the clinic and the hospital, so please be patient with us. We're all doing our best.
Well, thank you very much. Yes, good advice. So we just let everybody out there know, just take care of yourself, be safe, and just remember, here at Heart of America, your health is our passion.